I just passed my CASC exam. So the CASC exam is the last of the exams that you need to be a member of the Royal College of Psychiatrists, and I'm going to share all my tips in this video. The CASC stands for the Clinical Assessment of Skills and Competencies, and you're eligible to do this exam once you've passed both paper A and paper B. Once you've passed these exams, you must also have 24 months of experience in psychiatry. So once you do this, then you do the exam. So the CASC is an OxfordPsych exam. So for me, at the time that I did it, it was still being done virtually, but I understand there are plans for it to be back in person. So basically, there are 16 stations. You have 8 in the morning and 8 in the afternoon. Each station has 7 minutes, and you have 4 minutes to read the instructions in the morning stations, and you have only 90 seconds in the afternoon stations. After about 6 minutes, then you're given a 1-minute warning. So that's how the exam is. You do one station, then you move on to the next, and then you have a rest break as well. The pass mark for this exam is you must pass at least 12 of the stations and also pass the pass mark of that day. So it's going to be different for every day because the exam is different every day. So for me, at the time that I did my exam, the pass mark at the time was 67%. So I had to pass both more than 12 stations and also get more than 67%. In terms of study resources, so I used a few study resources. So the first one is a course. So the course that I did was called the OxfordPsych course. This was about 3 days intensive study, and I felt like it was really worth it. It did cost about £945, which is a lot, but for me it's covered by the study budget. But I found that it was really worth it because they give you some sort of structure that you can apply to any station, that no matter what station you're going to, you have some sort of structure and not just having to cram stations. The next course that I did was called the Psych Masterclass. So this is something that is free. You don't have to pay for it, but you have to be invited to do it. So at the time that I did it, they were inviting only, like they send out information and say, oh, we have this course coming up, and then you apply. So the first time that I applied, I didn't get it. The second time I did, and I was accepted. And again, I also loved this because it was also giving you a structure, because one of the main things is that you have to have a structure. Don't be asking questions to the patient and being random with no direction of where you're going. So I really highly recommend this if at all you're eligible for it. It's meant to be done for people who have a harder time traditionally passing this exam, especially like international medical graduates. Yeah, so look out on the OxfordPsych website for this course. The next thing is mocks. So I did do the SPMM mocks, and so what happens is that the mock is it's like a trial of how the exam will be. It was virtual on Zoom, and you go and you do the entire where the exam would be, really 16 stations, and it was good practice so that you know how to just have an idea of what the exam will be like and get used to that station I guess system. I feel like if you have limited resources, so if your study budget doesn't cover this, then this is something you can miss out on, because they don't really give you so much feedback. Like they give you some individualized feedback, but I didn't really feel like it was too much, and also they don't give you like a structure. So maybe if you attend their course, but in terms of their mock, then it was good to practice, but I feel like if you're limited on resources, this is something that you can do without really. The next thing that I did was that I had mock practices by my deanery. So my deanery, which is KSS, did have also practices that were done where there were some consultants that agreed to be examiners. We had actors, and then we were also practicing basically and being given personalized feedback. So if your deanery does this, then please do take part, because I found it really helpful. The next thing, which I've already mentioned, is just to practice. Make sure you're practicing a lot. So what I did was that I started practicing even before any formal practice with one of my colleagues. So if you don't know anyone who's doing the exam, just ask in your local WhatsApp group. So I did ask actually the other person did ask in the local WhatsApp group if anyone was planning to do the exam at the time that we did it, and then I said yes. So we never actually met before, but we were practicing virtually as much as we could. In terms of time, I gave myself 6 months. So I did my exam in September, but we started practicing, me and my partner, in March. And initially, you do whenever you have time, maybe every other week. Sometimes you miss 2 weeks because we have very busy schedules. But the closer you get to the exam, then the more frequent the practice gets. I also practiced with my consultant, who was really good. So if your consultant is good enough to help you, then you can practice with a consultant, especially if they have experience, because some of the consultants are actually examiners, and so they're able to give you some more advice. In terms of the books used, I used the Maudsley Training Guidelines, which I'll put a picture here, and this is the one that I used mostly. So we practice most of the stations here. I can't say I did all of them, just as much as I could, at least to make sure you cover every topic. And then once in a while, we also use the book called Pass the CASC. So that one was also good because it has a few different stations that are not in the other one. But mostly I use the Maudsley Training Guideline, which you can actually get for free if you are a PMT member of the Royal College of Psychiatrists. You can get a free one at on the website. I think they give you an e-version, or you can check your library. The one I used was from our library. In terms of the actual exam, my own advice is to make sure that you're having a smooth intro, like have a smooth intro of how you're going to introduce yourself, of which for me it was, hi, my name is Sissy, I'm one of the mental health doctors, and then summarize the information you've got in the scenario already so you don't have to repeat things. So just have a smooth intro because I feel like it sets you up for like success depending on how you start. Another tip in terms of mindset is to make sure you're approaching it the way you'd approach a real person and not necessarily like an exam, because once you consider it like an exam, then you have added anxiety. So of course you're going to have anxiety, but that makes it kind of worse because you're like, I have to pass. Just treat the actor as you would a normal patient, and then probably you're going to pass. The next tip is to make sure you have good lighting. So for me, I used my YouTube lighting, especially if you're doing a virtual exam, and also good audio. So I used the headset because you won't be able to hear the people properly, and they want to be able to hear you clearly, and also you have to be like clear enough for you so they can see you properly. Another tip is to have a backup laptop just in case, because for me, my laptop actually failed halfway through, like after the morning session. The second time around, somehow they couldn't see me, and then I was so lucky I had a backup laptop. So if possible, have a backup laptop, but also do your onboarding on the second laptop as well, because when you're coming close to the exam, they'll send you a link and you can do an onboarding to make sure your laptop works. So sometimes you can even use your work laptop, but make sure you do the onboarding in advance, because most work laptops have like firewalls and proxies and things like that, which might affect your like exam experience. So have a backup laptop. So if you're an IMG like myself, my special advice for you is to focus on your communication skills and also practice with people who are not like fellow IMGs all the time, because you want to be getting some practice with some British people or people who have grown up here, because there are a lot of times where one of my study partners was brought up here, and a lot of times I would say things and he would say that sounds rude and I wouldn't have noticed because like it's not my culture. So I think try and focus on that, especially practicing with people who might be like British people, to try and see that you have the communication skills that they're looking for. The next advice is to make sure you have a structure for each exam, because a lot of times they do change the stations. So one of the stations looked like it was a PTSD one, but actually turned out to be depression, and that kind of threw me off. So try and keep an open mind. So don't go in thinking that you know the station. So that's it, guys. I hope you enjoyed that video. If you did, please give it a thumbs up, and if you want to watch more videos like this, then please do subscribe.